when America was just starting out and we were heading west, you had to be really good at farming to survive. And to be good at farming, you need a really good barn. You see, barns are essential for keeping your animals alive and keeping your food good between harvests, because Midwestern winters just wreak havoc. So if you didn't have a really good barn, you didn't make it very long. So the successful communities developed a concept called barn raising. And this is where a master craftsman would plan and organize the whole entire barn raising a day or two before, and then the whole community would come and pitch in and build a barn. They contribute the skills and efforts necessary to do what needs to be done. And they built amazing barns. This barn raising process had achieved a couple of different things. For one, well, they built a barn real quick like. Number two, it was a community event. People came and socialized, and they partied down in the barn after they built it. And thirdly, most importantly, this process leveraged the collective intelligence of the crowd, of the community, to build the best barn design possible. You see, those master craftsmen just got done building another barn. So they brought that wisdom and insight they learned there to this barn. And then they'll go on to the next community, help them build their barn, train other craftsmen, and it would just keep going. They would build better barns and better barns. Fast forward a couple hundred years, and we have this process perfected. This was done in 13 hours. Now, thankfully, we don't have to depend on barns for survival anymore, but community collaboration is still going strong. Today, it takes the form, various forms across thousands of different projects. A common example you probably know of, heard of, is open source software, and that is where software developers will come and contribute code, do bug fixes, and contribute back to a bigger project so the project is better overall. And in return, they don't necessarily get paid, but they do get to use the better piece of software in their own projects. A common example of this is Linux, probably the first operating systems that was open source, and Android, which is built on top of Linux. And then you have another model called crowdfunding, with an example of GoFundMe. And this is where people come together, they'll contribute funds to fund a worthy cause. And then we have Wikipedia, which is a crowdsourced encyclopedia. And I'm sure not everybody knew that, but you have volunteers from across the world coming together to contribute their time and their knowledge to write the articles you see on Wikipedia. Then you have volunteers, come behind them and edit those. And I probably have thousands of people to thank for getting me through college. And I'm here today to talk about how we can harness the power of the crowd to solve a big problem that affects each and every one of us, and that's the American healthcare system. In 78.4 years, that's our average life expectancy here in America. And that has been in decline for the past 3 years, and that definitely worries me. And this is that number on a chart. Now, the horizontal axis is the amount we pay per person in a country to get the life expectancy, which is the vertical axis. And you can clearly see that we're not equal. All those gray and black and dark lines, that's the top 35 developed countries. And they have average life expectancy of around 82, 83 years, and they're spending $3,000 to $5,000 per person in the country to get that. You can clearly see that America is off track, way off track. And I failed to say that this is actually over time. This is from 1970. So it's clear that we spend twice as much as a country to die 5 years sooner, and I don't necessarily like that. There are a lot of problems with this, and there's a lot of problems in healthcare. But I believe that the root cause of all these problems, and my research keeps leading me back to how we pay for healthcare, and specifically having health insurance companies do that. So I want you to know that health insurance does not equal health care. Insurance is a financial instrument designed by a financial institution. They are designed to profit, not provide care. And lately it's becoming clear that there's a conflict of interest between the insurance companies and the patients and the healthcare providers. We're all fighting over the same dollar, and they are winning. This chart right here, this actually sums up America's healthcare problems. And this has been cited a bunch as the only chart you need to see all the problems. And here, once again, on the horizontal axis, we have over time. And this is the growth of healthcare administrators and physicians since 1975. And don't miss that little teal line down at the very bottom, because that's the growth of physicians. We've a little bit more than doubled over the past 50 years. But you can clearly see the growth of hospital administrators. Closely, about a 4,000% increase since 1970. Now, yeah, hospital administrators, some of them are needed, but majority are spent billing insurance. Matter of fact, the average overhead for a clinic, 50% of their overhead is spent on just billing purposes, just trying to recoup some money. And I just saw a chart, a study 2 days ago, it was 68% for this one particular clinic, just trying to get the money. It's crazy. And as you can see here, there's a couple things that I want to point out. It's the prospective payment system, HIPAA, and Affordable Care Act. And these are really three major government regulations regarding insurance in healthcare that have really just set us on a bad trajectory. I'm not going to get into that, but the idea is the more complex we make it, for some reason we decided we needed to hire more people. Then we hire more people, we just need some more complexity, and then we hire more people. And it's just a vicious feedback loop that causes that yellow line you see there, which is the increase of spending. And there's a lot of bad things that are forecasted in the future. But what if we do continue this chart out 10 years and 20 years? What will that look like? Well, I'll give you one stat. Last year in 2018, the average family of four, the average premiums, annual premiums were $28,000. Doesn't include copays or out-of-pockets. This year it's expected to be $30,000. In 8 years it's expected to be $50,000 just for premiums. That's not sustainable. So any families of four in here? Do you? Yeah, well, I feel your pain because I am also a family of four. And when this little guy here made me a dad for the first time, my perspective of the future really changed. And really, especially now that I had to keep this little human alive and I was legally responsible for it, it changed the way I viewed healthcare. And it just changes the way I realized that things we do today affect his generation. So as I held him, he was a few days old, I had some quiet time to sit there and just think about what his life was going to look like in the future. I started thinking about education, started thinking about technology, and then I got to healthcare. And since I was already neck-deep researching the problems in healthcare, I realized it was going to be absolutely terrible if we don't fix it today. Kind of reminds me of that Chinese proverb, the best time to plant a tree was 20 years ago, and second best time is today. So right then and there, I knew what my calling was in life. So I made a pact with my 3-day-old son that I was going to dedicate the next 30 years of my life to building a better healthcare future for him. We shook on it and everything. And my little daughter wasn't in the picture, but that was for her too. So I started with a thought experiment. What if we took that neuralizer pen, like in Men in Black, and we just wiped our memories of everything? How healthcare is paid for, financed, all of it. And we started with the basic fundamentals. We have people who may or may not get sick, and then we have a group of providers who can provide that care. And then we have some way to pay for it there. So I want to focus on how we pay for it. So you see that number, $2.8 trillion. That is actually the total amount that we as the people pay for healthcare. If you add up everything us in this room paid for premiums, our copays, our out-of-pockets to reach our deductible, and the taxes we pay for Medicaid and Medicare, you add all of us up, everybody in the city, state, country, $2.8 trillion. That's a big number. It's kind of hard to relate to. Well, we only spent $800 billion on the entire global military budget, so that's a very big number. So then I started thinking, well, okay, that's how much we put into the system last year. What does it actually cost? What if we went to the doctors and just paid them directly? Took out a credit card, paid them directly. Well, it took me a little while to figure this out, but $1.3 trillion, that's what it would cost if we just paid doctors directly and we cut out insurance. It's pretty simple math. Like, what we have going on right now is not working for us. So, in relation, I just want to throw some context out there. Those other two small little areas, that's how much it would cost for us to eliminate homelessness and poverty in this country. So what would it look like if we did cut out insurance and we did pay doctors directly? Well, it would look a lot like what these physicians are already doing. This is a map of doctors who are adopting a new model called direct primary care or direct patient care. And they're cutting up their insurance contracts and all for going straight to cash pay. Going to a subscription model, you can think of it as Netflix for healthcare, a gym membership, where you subscribe an affordable monthly subscription. Typically, I think national average is about $70, and you can see this doctor as many times as you want to. Unlimited visits. You can call, text, email, video chat, same-day appointments somewhat. And you get wholesale medication prices and labs. And if anybody has a subscription with a DPC provider, you know that it's so much cheaper than anywhere else you go. Now that we have this new business model that's being tested out, you're probably curious about the different colored dots up there. So the green is pure cash pay. They've cut up their insurance contracts, and they just offer a subscription-based model. The red is a hybrid. They're testing this out, testing the waters, still accepting some insurance, typically Medicare, and going cash pay only. The blue or purple are on-site clinics, on-site or near-site clinics, where employers contract directly with primary care doctors, kind of like sports teams have a team doctor, and you now have a company doctor. And the yellow is undefined, really. So now that we have this business model working, it's still in the experimental phase, and it's kind of cool because doctors are helping other doctors. They're sharing what works for them, and they're iterating on it, and the business model is getting better and better. But how do we scale this business model to specialists, to other specialties, for our social care programs, for our children, for our elderly, for our poor and disabled? How do we scale this model to all of them? Well, I think we need to bring everybody to the table. We need input from the people in the trenches. We need input from the doctors, from the patients, the caregivers, the people that are actually experiencing this every single day. And we need to sit them down. We need to ask, what do you want? And what do you need? And then we need to build it together. We need to build the barn. And this is an example of a modern-day barn raising. This is actually the start of an open-source movement called Citizen Health. And the objective behind this is, and we are crafting a plan for the American people. And this is, we have doctors, we have attorneys, we have executives. We have people from all walks of life who are contributing to this, contributing their skills and their experiences necessary to craft something that works for everybody. So what's the objective behind this? It's pretty simple. We're trying to connect patients directly to providers that can provide care. And we're doing so in the simplest way, and putting the patients and the physician's best interests at the top. While I've started this movement, it's becoming out of my hands. People are picking it up and running with it, and it's amazing to see it work out. But this is something that we plan to do over the next year, for the rest of 2019 and going into 2020. The goal is to have a polished plan that we can present to our government and basically say, here is an answer for our healthcare problems. We already did all the hard work. So that's our goal with this. Is that crazy? Audacious? Yes, definitely so. But if we keep doing the same thing that we've always done, we're going to keep getting the same results. We've got to think differently if we're going to change anything. So in the next foreseeable future, and already, you're hearing a lot of talk about Medicare for all, and soon to start hearing an alternative to that plan. Now, there's pros and cons to all of it, but when those discussions happen, and they will at every family get-together and at every bar, you're going to start talking about healthcare. When that does come up, I want you to think about this talk. I want you to remember that there is a better plan being built, and it's being a plan that is fair and honest and transparent, and one that is being built by people just like me and you, people that just want to see a better healthcare future for our loved ones. See, we don't need any more political agendas in healthcare. We need solutions. And we need an American solution, one that is built for us and by us. Thank you.